This week, the latte giants in South Korea live streaming their cautious first steps towards normalcy. Empty seats lining the stadium, face masks a new part of their uniform. As deaths around the world from COVID-19 surpass 20,000, all eyes are on South Korea, which appears to stand apart from the rest of the world. Last month, the country had seen 909 new cases in a single day. But today, South Korea is reporting only 100 new cases. This as infections in Western countries soar by the thousands. It's believed Korea's twofold approach of extensive testing and social distancing has slowed the spread of the novel coronavirus.
They did over 300,000 tests, and through that, they were able to identify cases and then look for contacts and really snuff this out in an incredible way.
President Trump is reinforcing his hope that the U.S. can reopen for business by Easter, warning that the restrictions may push the economic downturn to the point of no return.
I'm not going to do anything rash or hastily. I don't do that. But the country wants to get back to work. Our country was built to get back to work. We don't have a country where they say, hey, let's close it down for 2 years. We can't do that. It's not our country.
But that's a little over 2 weeks away. And with the number of cases dramatically rising in America, healthcare experts are skeptical.
The last thing any country needs is to open schools and businesses only to be forced to close them again because of a resurgence.
What do you make of the president's optimistic suggestion that he may begin to scale back on the restrictions by Easter?
So it's wonderful to be optimistic that these interventions are going to work, but that doesn't line up with the epidemic models that currently exist, unfortunately. We see the epidemic continuing to grow well into April.
Now, as Americans are left staring down an uncertain road, we look to other countries to see what they have done to contain the spread of the virus. In South Korea, widespread testing has been the game changer. Our South Korea Bureau Chief Joo-hee Cho visited the testing site in the fashionable Gangnam district of Seoul.
We tested 150 testing a day. And many students who come from abroad can get a free testing even though they have no symptoms.
Here, thousands of test kits were made available within 2 weeks of the country's very first confirmed case in January, the same day the U.S. recorded its first diagnosis. South Korea has tested far more people for the coronavirus than any other country, at a per capita rate of more than 40 times the U.S.
The countries that got a jump start on testing were the ones that ultimately are successful in bending the curve.
But while South Korea may be the leading example of what to do right, it's not a direct comparison to the U.S. South Korea has 51 million people spread across just 38,000 square miles. Compare that to the sheer size of the U.S., nearly 330 million people and 3.8 million square miles. Another major part in South Korea's effort to flatten the curve, turning people's phones into a weapon of mass communication.
The government here sends out national emergency alert messages throughout the day. It's basically information about who was tested positive in my neighborhood. It's very much in detail, too.
While hospitals in the U.S. are scrambling for masks and other personal protective equipment, South Korean hospitals are well-stocked thanks to swift government action early on. And just this week, President Trump asking South Korean President Moon Jae-in to send medical equipment to the U.S. Moon telling reporters that Trump sought, quote, urgent help. Hong Kong also appeared to be a success story in getting the virus under control. But then it let its guard down, and cases more than doubled in the last week, most imported from overseas. American Kathleen Pierce works in Hong Kong. No one is sick, but she and her family have been isolated in their apartment for more than 2 months.
We haven't been doing much. It gets boring at times. I mainly play a lot of video games.
Kathleen says the outbreak was more controlled in Hong Kong because it's been through major viral outbreaks before.
My friends and my colleagues here all experienced SARS, so they've lived through this before and they know how long a situation like this can last.
The Pierces thought they could see the light at the end of the tunnel, but just as restrictions were loosening up, travelers from North America and Europe who initially evacuated are returning and bringing the virus back with them.
It's a roller coaster. In the beginning, there's a lot of momentum, and then you sort of lose motivation as the weeks go on.
China is having a similar issue. It's now imposing a 14-day quarantine on anyone coming into the country. Now, more than 3 months after the emergence of COVID-19, officials there are trying to get the country back on track. In most places, people are allowed to travel, but they are given a health code scanned before getting on a bus or shopping at a store. Yet another positive sign. Official media showed workers back at the Honda factory in Wuhan, the original epicenter. But looks can be deceiving.
I am Max, 28 years old and from Colorado.
Max Seward and his wife and baby chose not to evacuate Wuhan when the outbreak began. Restrictions are finally relaxing a tiny bit.
As you can see, we're outside. We still can't leave the neighborhood. There's a gate over there. There's still like razor wire on it and stuff. Everyone has to wear masks and stuff.
Still, no one is allowed to leave the city or enter it, unless they have special permission, like those factory workers.
We're wearing like short sleeves now. And when this began, it was snowing and stuff. So it's almost been an entire season.
But over in Europe, the virus grip is growing tighter. Italy now has the highest death toll for COVID-19, and more than 74,000 people have tested positive.
Could you have ever imagined a crisis like this for your country and your profession?
This is a real catastrophic event. Many people, many families has a death, has people ill, some in the hospital, some in the house. It's a very stressful situation.
Dr. Mirko Naccioti works at Papa Giovanni Hospital in the hard-hit city of Bergamo, ground zero in the fight in Italy. The country went into lockdown last month, but its hospitals remain overrun. Naccioti offers these words of advice to the U.S. and its healthcare workers.
Keep COVID in your home.
Keep it in your home.
In your home, yes. Because if you manage COVID at home, you avoid contamination. It's very important to change your mindset from patient-centered care to community-centered care.
What does that look like?
You have to find solution for all the population, not for one patient. And this requires a community approach.
He advocates using more home care and mobile clinics to treat the mildly ill and free up the hospitals for the most severe.
Doctor, I know we are just meeting on Skype, but you look tired to me. Are you okay?
Yeah, I'm okay. I'm a little bit tired, but I'm okay. This interview is a way to help other people to avoid our problem. My mistake can give you the possibility to avoid this mistake and to save lives in your country.
Spain is now seeing a faster infection rate than Italy. These images posted on social media show a hospital overwhelmed.
How bad will it get here?
For what we're seeing in New York already, where we're reaching capacity in many hospitals and we're seeing the accumulation of deaths, it's very much looking like the way Italy has been growing.
The U.S. outbreak is about a week behind Europe's. Officials here hoping they can avoid heartbreaking images like this.
This is why we keep saying to every American, you have a role to protect each and every person that you interact with. We have a role to protect one another. It's why we are social distancing and you are social distancing. But to every American out there, when you are protecting yourself, you're protecting others. You can see the number of deaths that are occurring. We all have a role in preventing them.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.